Hello, everyone. Thank you so much for joining our webinar today, which we have titled, OMG, I have an out-of-spec micro sample. What should I do? I'm Scott Mishaken with Eurofins Marketing, moderating today's session. Joining me as our featured presenter is the Chief Scientific Officer for Eurofins Microbiology, Dr. Doug Marshall. So in a minute here, I'll hand this over to Doug, but first I want to relay a few general notes of the webinar structure. Of course, the webinar is being recorded. Slides for the webinar and the presentation and the recording will be emailed out to everyone registered within 3 business days. We'll also post the webinar online for on-demand viewing. During the webinar, you can always submit questions, anything that has come to mind. You can do so using the sidebar menu. So just select the questions tab, type in your question there, and hit the enter key on your keyboard. Remember, you can always do that throughout the webinar, and after the presentation, we'll have a short Q&A section to answer any questions raised. All right, so that's it for me on the brief intro. Doug, I'll hand it over to you. Let you begin.
Thank you very much, Scott. It's a pleasure to be back on the webinar series. I do appreciate everybody's time. You're going to invest in me for the next hour. The topic here is something I've been thinking about a lot for the first half of this year, simply because of my workload has been invested with our customers, helping them do harbor site investigations. And what usually initiates a harbor site investigation is a finding of an out-of-spec microbiology test result. And I thought that it would be good to be able to compile some best practices that I've learned over the years and share those with you. So that's where we're going to go today. I want to start off by giving you a quote, good, bad example. And I'm not going to reveal who the company is or who the individuals are. Some of you may be able to guess pretty quickly the event I'm referring to. But in this example, a company very recently pled guilty and agreed to pay about $20 million to FDA because they were operating a ready-to-eat food facility under insanitary conditions. And this food facility and the product that it was manufacturing was involved in a 2018 salmonella outbreak. And some of the circumstances around this outbreak are listed here. And what is pretty evident is that over a 2-year period, the company was doing routine environmental monitoring testing because when they were developing their food safety plan, they identified salmonella as a hazard that was reasonably foreseeable and that it could be difficult to control if your GMPs or your sanitation was not working well. And they discovered that salmonella was present in the plant 81 times over that 2-year period, including at least 1 positive salmonella sample each month. So all of these 81 out-of-spec results over this time period should have been clear evidence that the company's processes were grossly out of control. It was also revealed that employees at the facility routinely failed to implement corrective actions and preventive actions to address all of these positive salmonella test results. And indeed, the company's director of quality assurance until September 2018, where the person was terminated, recently pled guilty to 3 felony misdemeanor counts. That individual is scheduled to be sentenced, I think, sometime this summer. Sorry, my computer, there we go. When we think about how we generate out of specs or how we generate tests that lead to out of specs, most of these are going to be coming from one or both of these behaviors. And so I want to define these 2 terms for you so that we kind of have an understanding of where we're going for the rest of the talk. So validation is the collection of scientific data that demonstrates that a preventive control is designed correctly. meaning you're designing this preventive control to achieve an outcome, and then you implement the preventive control to see if that outcome actually occurs. So you're collecting data that shows that your process works. Verification also is scientific data that demonstrates that when you use a validated control, it's giving you the outcome you expect. So for example, for sanitation, we design a cleaning and sanitation SOP. The goal of that is to remove soils and to eliminate pathogenic microorganisms from environmental surfaces in a facility. If during the routine verification activity that you're doing after deploying the validated program demonstrates out of specification results, then that's evidence to say that my cleaning and sanitation isn't working. And you may need to revalidate or change something related to your sanitary operating procedures. So again, you can generate these data from monitoring whether or not your good manufacturing practices are working as intended. Again, sanitation, monitoring whether your process preventive controls are working. And a lot of this data is perhaps coming from your environmental monitoring program. So that's not a control, that's just a verification activity. So one way to not have out of specification data points is to simply do no testing. But if you do no testing, then how do you know whether your preventive controls are working or not? You may also be doing end product testing because your customer expects you to do so. So you're also collecting microbiology data related to that activity. So no data does not equal no problem. No data means you have no ability to demonstrate to an auditor, an inspector, or a customer that you are manufacturing safe product. And indeed, when you look at companies that have what we call rolling recalls, one of the reasons why they have rolling recalls, this is just day after day, they keep adding more production lots to the recall, is because when a regulator comes in and initiates an investigation, they're going to define a recall lot size as going back to the closest point where you actually have verification data showing your processes are under control. And when they have to keep going back, they're adding more and more production lots to the recall. And that's really an unpleasant marketing experience for the company, because you are broadcasting on a regular basis to your consumers that, number one, you don't have control over your products or your process. And number two, you're just telling customers, avoid my product. So, you know, the outcome of all this can far exceed just the cost of the recalled production lots. It can really affect your brand reputation. So what is an out of specification, an OOS, that we'll refer to as we go along in the talk? This is when your scientific data point does not meet a predetermined level. And so that level is a specification. And a specification can come from a regulatory authority. It can come from a trade group that if you're a member of and they expect certain product characteristics to be met within this trade association membership, or it come from your own expectation of performance. So you could have qualitative data. So this can include presence or absence of some attribute, such as a visual assessment of cleanliness. It either is clean or it is unclean. You could have positives or negatives. Oftentimes we use these terms to define an analyte that has food safety interests. So it could be a pathogen result, for example, or an indicator result. You can have detected, not detected, pass, fail, etc. You can also generate quantitative data, and if the result is greater than, less than, or at a predetermined threshold value, it can be in spec or out of spec. So again, where are you collecting these data? They're coming from doing verification testing of your incoming raw materials as part of your supplier verification program. You could be testing in-process materials to make sure the quality and safety attributes that you're generating with this in-process material is demonstrating that you still have control over the process. You can do it again, testing your finished products for lot release, and then testing of your processing environment. So I want to give you some specification examples just so that you know that there is a lot of this data you should be collecting on a regular basis. So visual observations. Keep in mind that this is potentially subjective. So if we put 10 people in a room and we ask, is this surface clean or dirty? We might get half of the people in the room say, yes, it's visually clean. The other half, if they see a speck of soil on that surface, they might pronounce it as dirty. You can also do a visual assessment for your GMPs, such as, can you visually observe aberrant employee behavior, such as ignoring hand washing or poor glove use practices? Those both have an implication on food safety. Then you can have analytical observations. This is potentially less subjective, but if the analyses are being done in-house, there could be a conflict of interest. That's what I call COI. Because again, if production management dictates what to do with the data versus those in food safety and food quality, then there is a definite conflict of interest. So some examples would be using ATP to verify the cleanliness of surfaces. So you could collect qualitative data. So you set a numerical threshold, and if the instrument says it passes, then it's a pass. If the relative light units exceed the threshold, then it would fail. You could also record the relative light units. Again, that gives you a quantitative measure of whether you're successful or not, and the degree of success or failure. You could generate data with microbial indicator counts, or you can also think about your pathogen detection results. What we don't want to be is this individual who has the final say in whether a production lot is shipped or not shipped. So this individual is responsible for reviewing all of your verification data that you're collecting around the manufacturing of this lot and making a decision on whether to launch or not launch this lot. I want to address something that a lot of people fail to have an appreciation for, particularly with pathogen testing, and that is if you're making a ready-to-eat food, if you have production failure somewhere, then it's unlikely you're going to get the entire lot contaminated with the pathogen. And so in this particular example, the big square that I'm showing you would be a production lot, and the small squares would be analytical sample units you could remove from that lot. So in the case, we could call it a 25-gram sample. So here we would have a production lot that is grossly contaminated, but the odds of you pulling a sample and discovering that that sample actually has the pathogen is quite low, even though we've got gross levels of contamination. This square also could be, the large square could also be your production footprint of your facility, and then each smaller square could be where you would be collecting your environmental samples when you're doing your routine investigation. And again, depending on the size of the facility, how you wrote your environmental monitoring plan, I know some places they would choose as little as 5 locations in a facility to test once a week, for example. And if you had gross environmental contamination, as this picture might depict, the odds of you finding any of those samples as out of spec are really quite low. Now then, think about what the odds are when you have really low prevalence. And in many outbreaks, the prevalence rate of a pathogen in a production lot is less than 2 to 5%. So again, that means if we had 100 analytical units we could remove from this lot, your odds of finding a positive are only maybe 2 to 5%. That means the majority of time, your specimen is going to come back in spec, and you would be shipping a contaminated lot and not have a clue that that was the case. So here again, when you have low prevalence, you could just close your eyes and point at your computer screen and see whether or not you could pick up this one analytical unit that actually has the pathogen in it. What happens if you have a large population of pathogen in the lot, but it's not uniformly distributed? So here again, we've got large population that is located in only 2 locations in that production lot, or if it's environmental. To the bottom of the bag, for example, or the tote, and the lighter weight fines could migrate to the surface. So I'm going to argue that companies should develop some sort of formal program on how to deal with an out of spec, because oftentimes when this comes in, it leads to complete chaos amongst the management team in a facility. And you know, well-managed facilities will occasionally get out of spec situations. That's actually a gift from that facility, because now you have something to manage against. If you're always getting back in spec samples, there's nothing for you to do that day. So you're not really managing anything. So my advice is to use a rational scientific approach, take the drama out of the situation. At the end of the day, your job is to determine recall risk and to determine food safety risk. Once you have defined both of those risks, then you can start mounting an attack to deal with the situation. First thing is, who's going to be a part of your response team? It may vary depending on the data that you're investigating, but at a minimum, I would use a response team to build a response plan. Obviously, your QA, QC, food safety personnel should be leading the charge. You should have participation from sanitation, production, and maintenance as well. So when you think about if you've identified an out of spec that points to a food safety implication, and you need to communicate to the public, you need to communicate to a regulator, you need to communicate to your customer, then here's a couple of recommendations I would ask you to strongly consider. Number one, use legal counsel, and choose your legal counsel from a firm that has experience dealing with food safety issues. They're going to be able to provide you with lots of advice on how to move forward. And you're going to have lots of choices on how you move forward. Which choice or choices are best for you? If you're the only one making the decision without outside counsel, you're missing a golden opportunity not to create a huge blow up for your company. It's also a good idea to get outside consultants involved. And I've been doing a lot of these in the first half of the year. And the one thing that is very common is it takes companies way too long to engage outside consultants. They would have brought in very early in an event. A lot of mistakes could have been prevented before they were made. So, you know, obviously choose consultants that are recognized food safety experts. You may also want consultants from public relations firms. All right, so again, what is the activity of this response team? Build your OOS response plan would be number one. Identify who is responsible for data control. If you have multiple heads involved, it gets messy very quick, and that simply adds to the drama. Also, you need to identify who is responsible for conducting the root cause analysis and the corrective action investigation. Maybe it makes sense to not use in-house employees for that. That's where consultants can come in and help accelerate the process. You need to also identify who is responsible for communicating to upper management, company shareholders, regulators, the media, and the public. This means you may have multiple people involved in the communication chain, but making sure you know who is responsible for what a priori, again, takes drama out of the situation. So once you have this plan, it's also a good complement to your company's recall plan. So again, my advice is rather than relying on a single individual, the response team should be responsible for conducting your OOS responses. One of the first things I do when I go in and help companies in events like this is I like to interview employees. And I like to start off with a group interview. So all the people who were involved in developing the plan would be the folks I would like to have conversations with. But be aware that when you're in a crowd and when you're interviewing people, these are the things you're going to run into, and you may not recognize the influence. So I'll ask everybody in a call. This is an opportunity for you to participate. You just hold up your hands if you believe it is human nature to lie. I can't see your hands, but and you don't need to voice an opinion. I'll also ask you, is it human nature to blame someone else? Raise your hands if you believe that is true. One that you may not fully appreciate is those who are most boastful in the interview process of their innocence probably aren't. And so that's a little trick I've used over the years, is thinking about who in this crowd is most defensive of their activities. And that defensiveness probably comes from a couple of things. Number one, they truly might be the one responsible for the situation. Or number two, they've had a history of problems being compliant with whatever task they're supposed to be doing. And then lastly, on employee interviews, it's also good to interview responsible parties individually, because you will hear different stories in private than you will hear in a group. So what are some actions that you can do? Again, I want to just focus for the rest of the talk primarily on environmental monitoring out of specifications, because that's what I spend a lot of my time on. So first thing you need to do is to limit access to the hotspot area by segregating that facility from the rest of the business operation. And this means physically putting barriers to prevent tracking of any contamination from that site elsewhere in the facility. So again, you could use yellow police tape, traffic cones, or other barriers to segregate that out of spec location. At the contamination site, then all nearby equipment should be completely disassembled and inspected for obvious harborage sites. And this includes, if you get a floor positive, look at the equipment around that floor positive and aggressively go after that equipment. You ought not wait for subsequent test results to be able to do this, because now you're just wasting time. So get after it and attack that and figure out, is this equipment a potential harborage site of the organism that you found on the floor? Because you need to quickly assess the risk. And if you ignore that equipment, particularly food contact surfaces, you're missing a golden opportunity to get quick resolution. After inspection of that equipment, then again, thoroughly clean and sanitize all those parts, surfaces, and tools before you reassemble. Resample that equipment and those surfaces to make sure that you have remediated those surfaces effectively. You don't need to know in advance whether the surface is out of spec or not. You treat it as if it is and aggressively go after it. Okay, monitor the area around that hotspot to find out whether or not it's localized, or whether or not you potentially have a harbored site somewhere nearby that you haven't discovered yet. Again, as you do pre-op inspection, if that fails, start over, re-clean, re-sanitize, re-sample as often as needed until you have evidence showing that that location has been properly remediated. Okay. Another failure that I see is companies that have remediated a location, they feel like they've accomplished what they needed to do, and then they put that location back into their routine monitoring schedule. I think that's a bad idea. You should keep that under an investigative monitoring schedule where you're monitoring with greater frequency, because what happens if an out of spec comes back? Again, that tells you that all that effort that you went through to try and find that harbored site and take care of it didn't work. A lot of companies fail to do vectoring around a hotspot. So the red spot here in this schematic is where we found an environmental OOS, and you should be vectoring around that hotspot. In this case, we're vectoring onto equipment, and some of that equipment also has direct product contact surfaces. So we're sampling those surfaces as well. Now is not a time to be afraid of causing a recall. You've already got an out of spec that says your process is out of control. What you don't know is where else you have out of control situations. So now's not the time to be timid. Now's the time to be aggressive and go attack this issue. Okay, with product out of spec, you are testing an end product, let's assume, and if it comes back out of spec, you have no information with that one single data point where in your process a failure occurred. Was it you inherited a supplier problem? Was it a process preventive control that wasn't working? Was it an environmental contamination event? Was it GMP failures? Was it sanitation? You're clueless. So you need to look at all the other data to try and help narrow down where your failure point is. So again, look at all your GMP verification data to make sure that you're in compliance there. Look at all your process control data, look at all your environmental data, look at all your ingredient verification data. Where companies have problem within product testing is a lack of verification data that demonstrates that all of these processes are under control or perhaps out of control. A lot of people ask me, hey, I've heard of NO60, what is that? Well, it's an example testing number for trying to release product that you suspect is out of spec. So in this case, this comes from an International Commission for the Microbiological Specification for Foods, and it's a testing recommendation for foods that are ready to eat and are destined for a high-risk consumer. So even if your product is destined for the general public, remember that many members of that general public are high-risk consumers. These are going to be the very young, the very old, people with underlying immune suppression conditions, and they will too be consuming your product in all likelihood. And so don't limit yourself to the production lot that you suspect is out of spec. It's also a good idea to test the lot that preceded the out of spec event. It's also a good idea to test any succeeding lots that have been manufactured because you're not getting your micro data back for a day or two. Also, if you need to rule out your supply chain, perhaps you got a certificate of analysis or a spec sheet from your supplier that says we tested this lot for these food safety attributes, they came back in spec. So what you have is a piece of paper. And maybe they share the analytical report with you from whatever testing laboratory they're using. But that's one data point perhaps on one ingredient lot. So you need to go back and verify whether or not that test result is trustworthy or not. Once you've collected all this information, then one of the other questions you need to ask is, what do I do with a production lot that may be potentially contaminated or out of spec? Again, you can test and hold. What if those test what if those test results all come back in spec? Is that enough evidence for you to feel confident releasing that lot? Again, you might have had an environmental specimen that was out of spec. At that point, you don't really have any evidence to say that the lot is out of spec that was produced on that equipment. You could perhaps reprocess that suspect lot if you have a microbial kill step in your process. However, you have to make sure that your kill step verification data was in spec, because what happens if you have a process control failure? Then reprocessing it without correcting that failure could likely lead to another out of spec. So a conservative approach is to destroy it, or you may be able to divert the suspect product to another use. So for example, you may have another customer that is okay with having, let's say it's a pathogen in that lot, because they have a process control that will eliminate it. Or you may divert it to a pet food or an animal food manufacturer. But if you do that, now you become under another regulatory expectation, and that's the preventive controls for animal feed rule. In any case, you really should increase monitoring of your sample volumes and the frequency you're collecting to further help you define risk of your products and your processes. I want to turn now to root cause analysis. And many root cause and corrective action CAPA reports are wholly inadequate for the issue at hand. They tend to be very superficial and tend to blame someone rather than blame a process. And when you blame someone, you know, Joe made an error. Well, why did Joe make an error? Well, maybe it's because Jane trained Joe ineffectively. So you can't necessarily put all the blame on Joe. You have to look all of your processes and determine, why did Joe make that failure? All right, so in your root cause analysis, first questions you need to ask are, did we have a GMP failure? Yes or no? If yes, what were those failures and what contributed to those failures, and what can you do to prevent those from occurring going forward? Did we have an environmental contamination? If the answer is yes, you know, why? Why did we have a failure? Was this just a transient strain that was tracked in from the warehouse, or did we have a harbored site? Did we have a process control failure? Again, if you've got a CCP failure, what led to that failure? And is there a way we can correct it or prevent it going forward? Do we have a supplier problem that contributed to the issue? If so, you know, you need to have a very difficult conversation with that supplier. And ultimately, it may affect whether you want to continue doing business with that supplier. Are my training programs effective? Again, Joe and Jane might be doing what they were told to do. Even if that behavior is faulty, it's not Joe and Jane's fault. It's whoever prepared the training program's fault. Are my SOPs accurate and detailed to ensure compliance? Most SOPs are really generic. They lack specificity, they lack performance expectations, and they lack information on what to do if you don't get it right. Okay? So for any of these, keep asking why until you thoroughly understand all the contributing factors that led to this out of spec situation. All right, CAPA reports. Again, these should be detailed, not, you know, Joe failed to clean the floor. Okay, why did Joe fail to clean the floor? So think about all the steps you're doing to remediate the situation. How does it relate to a root cause? How can you develop corrective actions? And how have you documented this thought process? And that CAPA report should provide evidence that demonstrates return of control of the problem issue. If this is an issue that you can fix, then obviously going back and looking at your SOPs or creating an SOP that includes preventive actions can help you reduce the risk of reoccurrence. If you continue to have a problem, then that tells you that your root cause analysis was not done correctly, or that tells you that your corrective actions didn't actually fix the problem. If you have recurring out of specs, this is a great time for you to consider a proposal to fix a physical plant defect. So if you've got a leaky roof that's routinely dripping in salmonella into the facility and company management is reluctant to fix that leaky roof, well, you use this evidence and you do some math behind that to demonstrate that why a capital improvement is necessary to stop the roof from leaking. If you have a piece of equipment that is just really hard to clean and sanitize and is a known harborage point, now's an opportunity for you to request from upper management replacement of that equipment with equipment that is built to better sanitary design so that it can be adequately cleaned and sanitized to eliminate the formation of harborage points. All right, what not to do with an out of spec. Failing to ask questions when any out of spec occurs is my #1 thing. And oftentimes this is because only one individual is involved in developing the investigation and doing the root cause analysis. So another failure is not to take an auto spec as a gift and do continuous improvements. This one's pretty common, continuing to do business with a supplier that fails to meet your spec limits. That may be because your spec limits are unreasonable, but it may be because your supplier just isn't stepping up to the plate and providing you with the ingredients that you desire. Failure to continue producing when evidence suggests you've got an uncontrolled food safety risk. So again, that bad example I provided you right at the beginning of the talk would be an example of a company that, despite the evidence, continued to produce contaminated product. I mean, talk about a plaintiff's lawyer dream lawsuit. That is clear evidence of negligence on the part of the manufacturer, and you are never going to stand a chance winning that lawsuit. Failing to make preventive capital improvements to correct physical plant defects, as I just mentioned, and not using an out of spec as evidence to pitch for a larger food safety budget. Another one, this might seem obvious to you, it certainly is to me, but when you get an out of spec, reducing verification testing sample volume and frequency. That goes back to that other slide where if we have no data, then we have no problem. So if we reduce our testing frequency, then we'll reduce the odds we're going to find an out of spec situation. Again, to me, if I was a consultant to the plaintiff's attorney, you know, if I saw a company that just was doing so little testing, they had no idea, that's evidence of negligence. So let's see what we can do here for an out of spec example. So the first one would be sanitation verification. You can do visual assessment. This tells you whether the equipment is soiled or cleaned. And I've gone into situations where companies, I would say the equipment is visibly soiled, and they would say, well, that's the best we can get it clean. Well, that's not adequate under anybody's idea of what clean should be. So for me, that's a failure of cleanliness that they were routinely passing as clean enough. ATP monitoring, this indicates the success or failure of cleaning. So it's a supplement to your visual assessment. Microbial indicator count indicates the success or failure of sanitation. Purpose of sanitation is to kill microbes. So if you have an indicator population that's still showing up, at what level do you consider it to be acceptable or unacceptable? Pathogen test, that one's obvious. Allergen test, that one's also obvious, because if you have the need for an allergen changeover, then your cleaning program has to be validated as effective to eliminate that allergen. And then you also need verification tests to prove that that in fact occurs when you do that changeover. So for many people, it's relatively easy to track quantitative verification data. Just put that in a spreadsheet and you can trend track your data over time. But what about trend tracking qualitative information, so pass or fail? So I'm going to show you a couple of examples how you can trend track. So this is quantitative information. So on the lower axis, we're talking about date. So whenever you collect the sample, so that's just a time course study. And on the other axis, this is some quantitative information. So it starts low and goes high. So you could have ATP relative light units, you could have indicator counts. And the importance of this graph is a couple of things. Number one, you can set your tolerance limit or your operational limit. This is what you hope to be able to achieve if you're doing everything right. And that would be the yellow line here. So, you know, your data is going to bounce around some, but operationally, you hope to keep your population level, whatever it is you're measuring, below that line. Your unacceptable level, this is where it becomes completely out of spec, is set at a bit higher level because that's when you know you've got process failure or control failure. So in this particular example, the blue line are your actual observation data. So let's say it's environmental data. And you're collecting this every day, every week, or whatever your frequency is. And it would be one location in this case. The data bounces around, but as you get above your target limit, then that's an early warning. You should start asking questions about what's going on in your process. You don't have to do a root cause or corrective action at this point, but you really need to start asking questions. If you fail to do those and you fail to identify an out of control situation, then the next time you collect a test result, now it could potentially be out of spec, so above your acceptable limit. And if you fail to act on that, then you can have a completely out of control situation, as this graph depicts. Then you need to do corrective action and bring the process back under control. I want to give you an example how you can trend track qualitative data. So in this case, if it's pass, fail, detected, not detected, positive or negative, any result that is in spec, you would give it a 0. Any result that's out of spec, you give that result a number 1. So in this case, this is environmental monitoring data. This company would be testing 8 different locations in their facility, and they would do the testing roughly once a week. And so if we look at the January 1 data on these 8 locations, you can kind of scroll down and you can see location 4 and 5 were out of spec. That total is 2 out of 8 locations were out of spec, or that's a 25% failure rate. So when you have these 2 out of spec, you need to do root cause and corrective action at location 4 and 5, and then do something that's a correction. So how did you do the week later? Well, a week later, location 1 is out of spec. Location 4 remains out of spec. That tells me that your root cause corrective action was deficient for location 4. Location 5 is in spec. Bravo, high five to everyone. Looks like we fixed that problem. Now we have location 6 that's out of spec. So we've got a total of 3 of 8 locations out of spec. That's a 38% failure rate. So overall, our cleaning and sanitation is getting worse, not better. 1 out of the 2 locations, it looks like our corrective actions might have worked. All right, so now we're really having difficult conversations with everybody on the sanitation team, everybody on the production floor, because we're going in the wrong direction. Let's see if we can improvement the next week. So January 19, in this case, all the prior out of specs have been brought back under control. So yay, we finally figured it out. However, location 8 now is out of spec. However, we've seen dramatic improvement in the total rate of out of spec. We've gone from 38% failure down to 13%. How do we do the next week? Well, again, looks like we're at status quo. We're better than we were earlier. Still a 13% failure rate. All the locations that have been previously out of spec, we've corrected those. Now we have a new location, location number 3. Look at February 2 data, and what does this story tell us? Location 4 again is out of spec. Maybe our corrective action wasn't sustainable. Now we have to go back and redo our root cause corrective action for location number 4. Overall, again, our performance is horrible. So now we're back at a 38% failure rate. So again, you can see how trending this data over time allows you to manage your processes. Without doing this trend tracking, then it's hard to visualize how your performance is going. That concludes my talk. I hope you've learned something new and learned how to control out of spec situations. And Scott, I'm happy to address any questions.
All right, thank you, Doug. I'll come back in now. We have seen a few questions come in, so we'll get to those. Of course, if you do have a question that pops up in your head, please do continue to submit. We'll get to what we can, and if we don't get to your question, we'll follow up with you afterwards. So let's getting through. Let's see here. First question. You talked a little bit about sampling plans in an N60 sampling plan. Is there a reference or a guide or something appropriate for low risk foods, maybe non-ready to eat and other processes that you can talk about?
Yeah, there is. The same document that recommended an N of 60 for high risk consumers of ready to eat foods. There are 2 other choices in that document. One would be for a somewhat lower risk ready to eat food that's destined for the general population. That has an N of 30. And then for non-ready to eat foods, where a customer is going to apply a kill step prior to consumption perhaps, then we're talking about an N of 15. You can also find the same reference material if you go to FDA BAM's website and look up the sample preparation chapter, and they've got the same information for Salmonella sampling guide. So if you want to ping me, I'm happy to send you those URL links.
Perfect. Thank you for that. Okay, another question along the lines of sampling. What is the best sample size for routine product testing, or what's the consideration should be made in that process?
Well, when I showed those 3 graphs where it's random luck of the sample draw, whether or not you find an analytical portion that is contaminated, means that when you have a large production lot and an analytical unit, according to FDA, is a 25 gram sample, most of the time FDA is going to be looking for ready to eat products for salmonella testing of at least a 325 gram portion. So again, that's 15 25 gram samples. So the larger sample size you can take, it improves the odds you'll find it out of spec, but at some point there becomes a limitation based on your budget. So for example, if the laboratories really only have validated methods up to 375 grams. So if you're asking for 60 25-gram samples, that's a 1.5 kilogram sample size. That's a lot of product to test, and the laboratories have to break that down and do 4 375-gram samples. So that's 4 tests and costs associated with those 4 tests. Will determine perhaps how many samples you want to test for lot release. If you're a dietary supplement manufacturer, for example, and the value of your material is really expensive, then testing 1.5 kilograms might be thousands of dollars worth of product that you just simply don't want to throw away towards testing. So in that case, maybe you want to use a USP sample size. All I can tell you is most of our customers do not test a large enough sample volume to stand a statistically valid chance of finding it out of spec when you have really low levels of pathogen contamination.
Okay. Let's see here, moving along. If I get an OOS sample for a production lot, can I just retest that production lot?
Okay. There's a couple of answers to the question. So on the yes, you probably should retest that lot, would be for investigative purposes. So again, the question is, let's say I'm doing a pathogen test and it comes back positive. What do I do with that lot? Well, you can pull additional samples from that lot to determine how widespread the contamination is. Obviously, if you find repeat out of specs, that tells you you have a serious problem with your food safety plan and with that production lot. The other thing not to do is you cannot retest your way to safety. So that is a quick way to go to jail. So in this example is, okay, you got an out of spec from the lab, you're going to pull an additional sample from the lot. If it comes back in spec, that is not a ticket for you to ship that lot. And you cannot test your way to safety once you have that initial out of spec result.
Okay, another question regarding environmental monitoring. So how much, and I guess when should people be concerned when for their product or lot, when there is a higher level zone OOS result? So specifically with like a pathogen indicator or something like that, and not necessarily with a predefined company spec.
Okay, I think the question is related to if I get a zone 2 out of spec, is that going to change my posturing compared to if I find an out of spec on a floor or in the employee break room? So from a risk perspective, I think the answer is, you know, those other more remote locations could be lower risk, but until you define that risk, you don't know what the actual risk is. And you don't know whether that out of spec on a floor, did it come from a transient strain that was brought on a forklift or a pallet, or did it come from a direct product contact surface that the organism got on the floor, maybe during cleaning and sanitation, or from just product movement. So until you define what that risk is, I'm not a strong advocate of treating a lower zone or a higher zone area, so zones 3 and 4, as less risky as something that might be a zone 1 or 2. Could be, but until you actually get data to define the risk, I'm not prepared to say you could ignore something that's further away.
So if they did get a hit on something further away, you know, would it be essentially monitor that for a little bit, or, you know, what might they do with like their product then if they have a lot? Would they consider the same steps to retest before releasing? Would they freak out the same, I suppose?
Well, at that point, you're looking at all of your other verification data. So was your supplier ingredients in spec? Was your process control working? Do you have data showing your GMPs were effective, data showing your sanitation was effective? So you can't necessarily jump to the conclusion that my production lot is contaminated if you don't have any evidence to definitively support that. So you may want to do additional testing of that lot to be able to feel more comfortable in that conclusion. But you can't just say, I found salmonella on the floor, therefore my production lot is contaminated.
That makes sense. Okay, turning away a little bit from that, but not related to pathogen testing and product or environmental monitoring, but for quality testing for spoilage organisms, would retesting be more acceptable in that case?
Well, again, it depends on your objective for retesting. If your objective is to figure out how widespread my or how out of control the spoilage organisms are, then absolutely retesting would be a very good idea.
Okay.
But if you just have one test result that says, I think this product lot is potentially not going to meet my shelf life expectations because my indicator count was too high, all I can tell you is it might depend on the history of that product. So if you have a history where a single analytical data point is highly predictive of shelf life, then perhaps you don't need to wait to do additional testing and you go ahead and respond as if it's not going to meet your performance expectations.
Right. Okay, it looks like we have time for maybe one or two more questions then. Question here, do we have to report our results to the FDA?
Well, the reportable food registry is required when you have evidence that a production lot is contaminated and that production lot is out in commerce. So under that scenario, then you would be required to enter into the reportable food registry that particular lot and the reasons why. If you still have control over that lot, meaning that it has not gone into commerce, then you do not need to submit anything to the reportable food registry.
Perfect. Okay, one last one then. Our talk here was about microbiology out-of-spec samples, but could you speak a little bit about whether manufacturers should follow the same recommendations or some of the same guidelines for a chemistry out-of-spec sample?
Sure. Really everything I've described today, with maybe the possible exception of some of the environmental monitoring stuff, would be applicable for chemistry food safety attributes. So things like undeclared allergens, presence of aflatoxin in foods that have ingredients that might potentially have aflatoxins, presence of heavy metals perhaps. So again, there's a lot of chemistry verification data testing that is done related to food safety and perhaps related to food quality that really nothing would change in my recommendations.
Perfect. Seems to make sense. Okay, well, I believe we're at our time, so we'll go ahead and wrap up our Q&A session. Again, if you didn't get to what you were asking or a question that you had, you can always continue to submit questions. We'll follow up with you on that. And again, one last time, a copy of the slides, recording of the webinar will be available within 3 business days. So, Doug, thank you again for your expertise and presentation. Thank you everyone for attending.
Bye now.
Thanks. See you next time.